I'm Kate Wessels. Thank you so much, Bertram, for the introduction. And I also... I'll just use this. I just want to say thank you so much for the introduction, and also I think we should just take a moment to acknowledge Bertram and his team, and also Kate for organizing this amazing event and allowing us all to be here. So thank you so much for that. So the first BSP talk will be by Selma S from Indiana University Computer Science. And the title is, as you can see, Developing Policy for Healthcare Robots in the Home, Learning from the Case of Telehealth.
She gets a little
Oh, now they're actually going to hold me to the
time. Okay, great.
X amount of minutes.
Thank you.
Thank you. Well, thank you very much, Bertram and team, for organizing this wonderful meeting and getting all of us who may, maybe some of us talk already, many of us are just meeting, and thank you very much for inviting me. I'm excited to be here. So, in a sense, I'm going to talk about some things that kind of grew out of research that we've been doing in the healthcare robotics realm. And in a sense, I'm also workshopping ideas, kind of like Julie was saying, which is, as we have been working in healthcare robots and studying actually how people use them. So I come from a kind of combo, what I call a combo social science background. I'm in science and technology studies, so generally critical studies of how technology might affect society, and I particularly focus on robots. And so through some of the research I've been doing there, we started kind of going further and further thinking about, well, what might be some policy areas that should start influencing the kind of work that's happening in this field. So I'm going to tell you a little bit about what we came up with in our consideration of this. So I'm sure many of you have heard about ideas of how we're going to have robots in our home. This Internet of Things notion is very much connected to that. And there have been lots of visions of even specific robotic technologies, like the many that you see here in this picture from Bill Gates' 2007 A Robot in Every Home article, that can somehow assist and take part in our everyday lives. And one of the areas that I'm particularly interested in talking about today is this notion of robots that might assist in healthcare. So even in Bill Gates' vision, you see the one that I kind of circled in red. There's a robot that's assisting an older adult physically, so by bringing things. There are also in this healthcare realm robots that are imagined as assisting as teleoperated, so telepresence devices where people in the family, caregivers, doctors, et cetera, can come into the home, communicate with people living there, and as well as robots that might be able to help in socially assistive ways. So basically help through the interaction, maybe as companions or different kinds of therapeutic devices like this robotic seal. That is actually, I don't know how many of you have seen it before, but it actually moves. It's not just a stuffed animal. And so my research has generally focused on on this area of socially assistive robots. And the seal in particular. And some of the things that we've been looking at is how, not just how individuals respond to the seal, which is actually what still a lot of human-robot interaction research looks at, is individual responses, individual attitudes, effects on individuals of using these different kinds of technologies. But we've been kind of trying to kind of expand out from there and look at things like institutions. How are these kind of robotic technologies becoming part of work in institutions? How do interactions with them change, or how do their effects change over time? So not just the first time you see the robot, but if you're using the robot for a month or more. Also, another thing that's become kind of interesting to us here is how does human labor, so in a sense, connected to what Julie was talking about, how is human labor inevitably involved in the support and scaffolding and actually making sure that these kinds of autonomous technologies work and do the work that they do? So one of the things, for example, that we studied is how this robotic seal, which is used as kind of a pet therapy robot, how it actually needs people to introduce it in particular ways, how it needs staff, and even the interaction of the residents of a nursing home to actually have it be accepted as this kind of socially interactive artifact, and to have that therapeutic effect on others. And then lately we've been working more in terms of how we can use participatory design and some more collaborative practices where we can engage with clinicians and engage with people who might end up using these kinds of technologies to actually figure out what they might mean for them, what kind of designs they need, and what they expect might be impacts, or what kind of questions do they have about these kinds of technologies. So this gives you a little bit of a background of where I'm coming from. And so through both our work and just reading what's been going on in discussions about the use of healthcare robots, we have a lot of questions also about not just their reception, but about their eventual acceptability and acceptance in society and in different spaces. So recently there have been several large-scale surveys that have shown that the public isn't necessarily very accepting of these robots when you ask them generally. When we've worked with clinicians and consumers and asked them about specific robots and discussed them and critiqued them, there's actually a general acceptance. However, interestingly, it's often an acceptance of these robots for others, not for themselves. So this notion of, oh, that's awesome, great, but not for me, it has been, we found it, but others have also found this kind of response. And then another thing that we've started kind of thinking about more and more is that although when we look at the impacts of robots, or how people will accept robots, or how people will respond, we think about different kinds of ways that we can design robot characteristics to improve outcomes or to improve acceptance. But in our discussions with clinicians and with people who might use the robots, one of the primary things that comes into their mind and into their comments is issues of cost. Who's going to pay for this? How do I get this? It's really nice that you're handing me the $6,000 thing and I can use it while you're doing your research, but if it's going to become a part of my everyday clinical practice, where do I get it? And so this is kind of one of the things that we wanted to think about further. And kind of maybe going on from that, there are also several barriers to technology that have been just discussed right now in the panel, but that are generally talked about in the field. So obviously different kinds of technical barriers. Everybody who works with robots knows how hard it is to have them actually work in some of these environments that you can't control. For example, you can a factory. A person's home isn't something that you can just reorganize so that the robot can do well. As well as, people have been looking at issues of interaction design. So how easy are they to use? How can you have functionalities that are actually useful to people? How can you make these things cost-effective, safe, et cetera? But one area that really hasn't been talked about very much is how do you develop, what kind of policy infrastructure might help us further work on some of these issues and actually start to implement, be able to implement some of these robotic technologies in society. And I think this is also considering that whenever we kind of put a technology in one of these human systems, it is also a question of behavioral modification, right? Something is going to change there. So this is what I want to focus on today, and this is kind of what our future paper is discussing. And so one arena, since this hasn't really been done in the realm of healthcare robots necessarily, one arena that we thought might be a good place to look at is telehealth technology policy. Because that is a space where certain kinds of policies have started being developed. And it does fit robots, healthcare robots actually kind of fit the definition of telehealth in some ways. So telehealth is this idea, it's the provision of healthcare remotely by means of a variety of telecommunication tools. And in robotics so far, this is mostly, as you can imagine, like the first thing that comes to mind are telepresence robots, right? They're obviously telehealth. But one of the things that we're interested in thinking about is, could this also be extended to other kinds of robots? Because even when there's not somebody necessarily controlling the robot, you can have robots that are doing remote monitoring and kind of sending data at different times, as well as robots that can give certain biofeedback or certain kind of therapeutic services, even when the therapists are not necessarily there. So we want to kind of extend the notion of telehealth technologies to encapsulate these. And so if we're thinking of policy issues for robots as these telehealth technologies, these are some of the things that, kind of looking at the literature, also thinking back on our previous research, we've come up with as some of the issues to tackle. So one is what I was just mentioning, this issue of cost, right? So how do you provide insurance coverage and reimbursement for robots? We don't necessarily at the moment. Then how do you actually incentivize the use of domestic robots in particular? Because a lot of, in some countries, in Japan, for example, particularly this Paro robotic seal, which is a product, so you can buy those. It's one of the few robots of its kind, socially assistive robots, that one can actually purchase. It's not an experimental technology. But the only place where individuals buy them is in Japan. Mostly they're institutions, and they're often used within the institution rather than in people's homes. But these days, healthcare is starting to focus on, keeping people, helping people in their homes, doing more prevention, more patient-centered, community-centered care, and therefore institutionalization is actually something that you would want to avoid. So how can we maybe use some of these, figuring out how to use these technologies in homes, also need some particular, we think, incentives. We also want to see how we can encourage research on uses of robots beyond telepresence in the home. And also, one issue is kind of identifying and working with what we think are going to be the primary consumers. And so, as I mentioned, often research is done with individuals, but it's highly unlikely that individuals will be the purchasers of these technologies. It might be organizations. So we want to figure out how to deal with that. So I'm just going to give you a quick overview of some ideas that we had of how to tackle these concerns. So in the providing insurance coverage, when we look at existing telehealth policies, one of the things that's kind of a problem is that they're very fragmented. So different states, different spaces have different policies. They're restricted by the type of service. They're restricted based on the diagnosis. And if we do end up trying to do something like aligning healthcare robots with existing codes, so existing things that people will pay for, we're going to have to deal with that. It will be similarly fragmented in different ways. And one thing that might be important for robot designers is that when you're designing robots, do we actually look at these codes and things that people can pay for? I haven't necessarily read it in the literature as a motivation for work, right? But it should be probably something that people have in their minds if implementation is part of, or using these things is one of the things we want to do. Another thing that we can try to do is ask people to create new codes. However, you can imagine the level of inertia there is in the system to actually find more things that an insurer needs to pay for, right? And so for the robotics community, one of the things that it would have to do is to actually very rigorously show what the therapeutic value and cost effectiveness of these kinds of technologies is, right? In terms of incentivizing domestic use, one thing that we could do is maybe have these policy and reimbursement structures that can encourage robots beyond telepresence, right? So maybe for remote monitoring or for early warning. But for this, we're also going to have to develop certain kind of technical and social infrastructures. So things like different kind of communication protocols, different APIs, HIPAA compliance services, those kinds of things, as well as establishing particular standards for using these technologies in kind of domestic environments that are not necessarily controlled by, that are controlled by individuals, not necessarily by an institution that's kind of overlooking and seeing what's happening with the robots. And then in terms of encouraging research beyond telepresence, As I meant, telepresence obviously still requires people to do it. And, one might imagine, oh, yes, we could, outsource this. And it'll be cheaper somehow, or cloud, or not we could crowdsource it, right, or something like that. But this is maybe a barrier to kind of the labor and cost savings that might be required to motivate some of these applications. So one of the things that maybe we should be looking more at also is how can we use autonomous robots that can interact, collect, and deliver information to people without constant direct teleoperation, right? And for this to be practicable, we need more different kinds of research. So I know that just from talking to people, we just did a recent evaluation of a robot and some sensors in people's homes. There are several of these projects ongoing, so I think that's very exciting. But really going outside of the lab to do this research is very important. One other idea that we had is maybe, we could consider robots as experimental therapies in a sense, and try to have opportunities to test them out in that way. Or we've been very fortunate to work with a large mental health provider in the Midwest. And so having maybe specific facilities or organizations that are interested in kind of looking at these experimental systems and these new technologies and figuring out how they can be usefully implemented within their kind of within their space, within the kind of work that they do, and with the certain very real constraints, both in terms of, the people that are affected, the very difficult and time-consuming work that clinicians constantly do. I think having these kind of specific facilities or organizations to work with would also be quite important. And we've already mentioned more interdisciplinary funding, but I think for this kind of work, particularly connecting with the clinical research community is really important, because one of the things that we don't have a lot of in the healthcare robotics realm are the kinds of studies that really convince policymakers, or that convince insurers, or that convince the medical community, which are things like randomized controlled trials, right? And so we need to be able to do more of that kind of thing. And so finally, the question of who's the primary consumer. So we do really, as I mentioned, a lot of research on individuals, but the main customers, especially I think in the US, are likely to be institutions. And perhaps one kind of arena where we could have early adopters are what are called accountable care organizations, which basically commit to covering the costs of some large number of people, and also sharing in any losses. And so they would, of course, be really interested in figuring out how to use robots to help decrease costs, particularly perhaps in areas where you help people, so in the preventive area, right, where you help people not go to the hospital, not go to the emergency room, which is very expensive and very unpleasant for them as well. And so I think one of the things to do is also look more at studies of this kind of adoption and criteria that organizations might use, or organizations such as this, to choose which robots to implement. And recently we've been working with one institution that has kind of several spaces in which they use robots. They're kind of like basically different buildings in which the robots are used with different populations. And they particularly use this Paro robot, and then now recently there's this, I don't know if people have seen the little robotic, they're cats and dogs, they're called Joy for All. And so then they started using those. And Paro, just to give you an idea, Paro is a $6,000 technology. It's very robust. We've actually left one in a nursing home for a year and it still works, which I think is a miracle, unattended. And then, and in some places, so they actually use the Paro very happily. In other places, they've left Paro and they started using Joy for All, partly for labor purposes of their own labor. So they felt that with Paro being $6,000, they can't leave it. They always have to be there. They're always worried that something's going to happen to it. It's going to get broken, stolen, So Joy for All, even though Joy for All is $100, and as you can imagine what you can get for $100, it's a much more, I would say, clunky technology. But they're using those because they can leave them with people. And they can have many of them, and they don't actually require, the staff to be overseeing the robot all the time. So even looking at these kinds of dynamics of labor within the institution, I think will be really important. So just to wrap up, this is, I believe, the final slide. What we really want to work at in the future is continue looking more at these, policy arenas and thinking about how they can relate with design, and how we can take into account the potential for developing policy or existing policy to help design robots that can start assisting people sooner rather than later. So as I mentioned, we can look at these codes, existing codes, and see how we can maybe design towards them. Do more things like long-term studies, randomized controls trials, in-home studies, and these specifically to see how the different social dynamics of the spaces affect how the robots are taken up or not. That's another thing. Martia had a wonderful paper recently on people not using robots when you give them to them. And so it's a very important thing to figure out. Why aren't they using them? It's easy, when you give them the robot to them in the lab, they have to use it. But at home, they can do all kinds of things with it. They can stick it in the closet. They can use it to shine their shoes. I don't know. But we need to know these things to make better, more kind of socially beneficial technologies. And finally, we have to also develop this kind of robot design research to address institutions, not just individuals, through looking at kind of behavioral institutional change, doing organizational studies with robots, as well as, I think, participatory design. So to get people who are going to be using these things for whom we want them to be useful in on making decisions about what they do, what they look like, what are the privacy concerns and those kinds of things very early on. So I just want to thank my team. There's also an undergrad whose picture I couldn't find, but there should be one more person there. I will ask her. I'm not Facebook friends with her, so it was hard. And also our collaborators and funders, and I'm ready for questions. Thank you.
I actually thought you were going to get through the entire presentation without mentioning privacy, and you got it just in under the wire. But, I mean, to me, that's actually a huge concern. I mean, I'm 63, so you could be describing my terrifying future. And hopefully very distant, non-existent future. And somebody who's institutionalized obviously has lost most of their autonomy, control, and privacy. And so I can see where somebody might think, well, the robot is safer. But, look at the FCC decision this week, the congressional vote yesterday on the FCC privacy rules. The potential for data collection on this very vulnerable group is really extraordinary. And so before you do all these other things, the privacy advocate in me really wants you to set up principles for how that's going to be handled.
I agree, and I think for that also we need more research, because I think
there's always more research.
No, because I think robots are a different, especially these kind of socially assistive, interactive robots that seem to be their own agents, are a different privacy concern. So privacy is a burgeoning area of research now in HCRI, and in some initial studies that we did. So we did one study a few years ago where we actually had older adults interacting with like a stationary robot, a mobile robot that followed them around, and a camera. And so what we expected was that the mobile robot that follows them around, because this was like a principle, that people had set up, is if it's a robot, it's there, right? You know that it's watching you. It's not like this hidden thing. However, what turned out to happen was that people, even though they were told that all of these technologies were controlled by their caregiver, right, who could look at them whenever, when it was they were very careful with the camera, even the stationary robot, but the mobile robot they seem to have attributed its own agency to, so they no longer considered it as, this they actually protected their privacy less in front of the robot. And so I think that's so we definitely need principles, we need policies, but I think to develop them intelligently, we also need to figure out what are actually people both like both how do they feel about possibly using sensors that are not, I know we're used to thinking of monitoring as cameras, but these robotic technologies have all kinds of sensors. I mean, you could just have things like, how many, are they touching the robot? Have they gotten out, things like that that are maybe much more obtuse in the sense of us knowing exactly what they're doing, but that on aggregate might give us some information about their health status that could be useful. So when we do the participatory design activities, we do talk to them about privacy, about different kinds of sensors. We have them try out different sensors, discuss how they might be put in the robot or not, and who they would share the information with and who not. I mean, of course, those are just preliminary discussions, but I definitely agree. That's a big issue.
Good morning, everyone.
Oh,
my question relates to human interaction with non-life objects. Will there be any restrictions, so to speak, on the areas in which robotic technology will dominate? That's one. And two, we are moving away from physical interaction with humans, so human to human interaction. We're moving away from that. We've now more on our phones and computers than we are speaking to the persons we interact with on a daily basis. And now we see soon to be in an adult stage, or very aged adult stage, now you will have interaction more with robotic technology than human life. Is there any consequence of that, and what research has been done in this area to see what we'll do? Because what I was thinking is, since the robots will dominate factories and so on, then with no jobs for these workers, they should be interacting in the homes if needs be, than having robots now replacing even in that area. So is research being done in that area as well?
Mm-hmm. I think part of the idea, and maybe part of why we're trying to go beyond the one-on-one interaction and look at robots in these social contexts, in the context of the institution, and the context of organizations that might be controlling them, talking to therapists as well as the kind of end users, is because for me, the hope is not to have the robot dominate. It's actually to have, kind of like Julie's description, to have the robot be part of the work, but really assist with some point in it where it can give aid to the patient, or maybe let's say it's an older adult, but some kind of patient, and also aid the caregiver. So as an example, I have two examples, one of like maybe a bad implementation, possible implementation, one of maybe a more positive one. So when we were doing research in an elder care institution, we did behavioral, like an observational study. So we basically just had the robot hanging out in a open space, and people could come up, interact with it however they wanted. And we were just looking to see, like, when do they interact, when do they not interact, how do these interactions happen? And one of the things that we noticed, that actually in terms of human to human interaction, one of the most common kind of serendipitous interactions was between the janitorial staff and the older adults. Because the nurses were so busy, they would run around and, they were constantly doing some task, but the janitorial staff would stop by and say, like, oh, hey, how are you doing today? I heard somebody came, et cetera, et cetera. And so technically, if we look at just, from a functional basis, the robots could take over the janitorial staff's job, right? Like, who wants to clean? There's also always that explanation. But if you take away the janitorial staff, and you don't find some way to give somebody else the extra time to have those serendipitous interactions, you would take away a very significant portion of their kind of social contact. So that would not be a good finding. So I think that's why we need these more broad kind of organizational, institutional, and kind of real world studies, so that we understand where people are getting some of this positive feedback that they need, right? And make sure that we keep that, not just replace it. And then the more positive one was actually from one of our participatory design sessions, and we were talking to clinicians, especially about this, well, what will happen if, we put robots in and the people don't interact with the clinicians? And they said something like, well, we actually have this staff member who goes to people's homes and makes sure they take their medicine. But she's so busy and she has to go to so many homes that when she goes, she doesn't actually really talk to people. She just makes sure that they've taken the pill, and then she leaves. And so if you could have something like even, give And then people are trying to talk to her at the same time. So it's very kind of frustrating for her because she's trying to, do a task, and then she's also ignoring this person that she would like to also help, right? So they were saying something like, well, even if you had something like Paro and she could take it with her, give it to the person to play with a little bit while she just finishes the task, and then they would actually have some extra time to talk for even a couple of minutes, that would be helpful. Or if you had a technology that could help a little bit with just did they take their medicine, and she didn't have to just drive from house to house making sure everybody took their pill, then she could have more quality, maybe not as frequent, but more quality interactions with each of them. So I think it's a very fine balance. I think you have a very good point that we have to be very careful. Yes,
Thank you
Peter.
for a wonderful talk. It's good to hear so much discussion and thought about the kinds of organizational, institutional contexts in which healthcare robots are going to be deployed, insurance concerns, and how we might be shaping regulation and policy there to enhance robots. And I was also excited to see participatory design pop up, at least in a couple slides there. But I wonder, I have a certain concern, I wonder if you share this concern, of giving too much attention to the organizations as these stakeholders, not only because they're the ones who are economically driving everything, but if we're also including their concerns and interests as the sort of primary stakeholders in the design of these systems, aren't we going to wind up with a bunch of technologies that further enable putting elderly people into nursing home situations rather than extending in-home care over time, because that is much harder to study, it's much more varied what individual preferences might be, and thus much more challenging to develop applications and technologies and markets for those things. And so what are the risks and challenges, and how can maybe participatory design help us to try to rebalance some of that?
I think one of the reasons why, particularly for this work, we were trying to pull out the like the ACOs and the organizations is because they're really not there at all. So in terms of studies of who are we, so I think the imagination is that the user, the end user, is the consumer or the whoever's going to pay for these. I guess the payment we don't get to very often in research, right? So I think that's why we're forwarding here. But I think your concern is very valid. So making sure that we actually keep with the with this notion of patient-centered, community-centered care. And that's partly why we started doing participatory design, is because one, in healthcare there's that push, but also to kind of bring it back really to people and their values rather than necessarily concerns just of efficiency or what is like technically exciting or possible, right? So I think you will definitely keep that in mind.